My name is Fjermestad-Noll. I am a medical doctor, a psychiatrist, specialist in psychotherapy, group analysis, and I've done a PhD about narcissism and depression. In this third presentation, I will look at the psychotherapeutic treatment modalities for treating the depressive symptoms in patients with narcissistic disturbances. The presentation is based on the article called Psychotherapeutic Treatment of Depressive Symptoms in Patients with Narcissistic Disturbances, a review. It is published in the Journal of Contemporary Psychotherapy, and it is a review of the current literature regarding the different treatment modalities that you can find. So the background for describing this is that patients with narcissistic disturbances, they often pose a specific challenge when you plan and perform the therapeutic treatment. They are often referred to treatment because of co-occurring conditions such as depression, and this is what we will look at in this one. And then I wanted to look at what are the challenging factors in the therapeutic treatment of these patients, and what are the common and important themes that come up in therapy. So there's a little bit of repetition for those of you who have seen the first two presentations. Remember again that the clinical presentation of narcissistic pathology is one where these normal aspects of self-esteem regulations are not functioning. So the self-esteem is disturbed and regulated through a distorted self-structure with the pathological grandiose self. The narcissistic personality disorder per se is then the characterological constellation that sustains this pathological self-esteem regulation. There's a phenotypic range of features that are presented, and this is very important to understand that you have to look for all of these different specific features, both grandiose features and vulnerable features, in order to recognize the narcissistic pathology. And I will summarize them very briefly again for those of you who have watched the first two presentations. The grandiose narcissistic features that we encounter are those of arrogant and self-serving attitudes, an attitude of entitlement, excessive need for admiration and validation, common expressions of omnipotence, having impaired capacity of empathy, having exploitative, dominant and reckless behavior, hostility towards others. There might be verbal, physical or sexual aggression, and narcissistic rage occurs in response to perceived insults or threats, and there are often aggressive counterattacks to criticism. They often have a lack of regard of normal norms, rules or laws. They are envious of other people, or they perceive others as being envious of them. They expect recognition without the corresponding achievements, and they have perfectionistic expectations of others. On the other hand, the vulnerable features are those of having low self-esteem, feelings of inferiority, vulnerability, being hypersensitive to criticism. There's a lot of procrastination, being shy, socially withdrawn and insecure. There is a very large preoccupation with others' perception of oneself. There is emotional dysregulation and the tendency of depressivity, lack of appreciation of achievements, a fear of rejection, and grandiose fantasies are normally entertained mainly on the mental level and are not outspoken. Before you get further into therapy, then you might come into contact with these grandiose expectations of oneself and others. There's a lot of comorbidity between narcissistic personality and depression. Runningstam has said that the prevalence of depressive disorders in patients with NPD can be between 42 to 50%. Stinson et al. Also found a high prevalence of mood disorders in patients with NPD, 28.6%, and major depressive disorder per se in NPD, 9.6%. Comorbidity et al. From 1995 found a much lower prevalence, 5%, but we do know that this is a clinical fact, that there is a high prevalence of depression in patients with NPD. So this article is from the PhD study, as I mentioned, on narcissism and depression. It's called Personality Pathology, Psychological Factors and Patterns of Depressive Symptoms in Patients with Narcissistic Disturbances. And this is the third study, which is about the treatment of depressive symptoms in narcissistic disturbances, and it's a review. So the research question was, what psychotherapeutic strategies for treating depressive symptoms in patients with narcissistic disturbances are identified when performing a systematic literature search? So the background for this is that the patients with NPD, they seek treatment often for co-occurring depression. They don't come to treatment saying, I need treatment for my narcissistic personality disorder, I need to work with my narcissistic disturbances. They will report for treatment describing having depressive states, feeling depressed, and wanting treatment for this. So the depressive symptoms might not be an expression of major depressive disorder as it's known, but it might reflect this consistent characterological functions that they have with great fluctuations of self-esteem and a pervasive emotional dysregulation. So the depressive symptoms could indeed be an expression of self-criticism, aggressive self-attacks, shame, loss of internal control, or fear of failure. So as you can see, these manifestations of the narcissistic pathology are very much in line with those that we see with the vulnerable features of narcissism. And often, if you think that the pathology or presentation, phenotypic expression of the narcissistic pathology may oscillate between the grandiose features and the vulnerable features, these patients will come into treatment when they are in their vulnerable state. So it's important to have a specific focus of therapy to achieve remission of depressive symptoms and prevent relapse of depression. And this is that the narcissistic pathology must be addressed in order to alleviate the depressive symptoms, because this is in fact at the core of these symptoms. So the aims were to describe complicating factors in the treatment of depressive symptoms in patients with narcissistic disturbances, to describe appropriate treatment strategies and methods, to provide an overview of the current literature regarding the therapeutic treatment of depressive symptoms in patients with pathological levels of narcissistic disturbances. So I performed a systematic electronic search on PubMed, Embase, PsycInfo. The keyword terms were depression, narcissism, and psychotherapeutic treatment. I retrieved a total of 661 articles, and they were selected for abstract screening. The abstract screening was performed using the Convergence software and performed by 2 different raters, one of them being myself. And then 77 articles were selected for full text review, and full text review was only performed by myself. The included articles had to have a description of the psychotherapeutic treatment for depressive symptoms in patients with narcissistic disturbances, or provide some background information on the co-occurrence of depressive symptoms and narcissistic disturbances. In the end, out of the 77, 23 articles were selected for the review, and then a further manual review of references and relevant papers found 6 more articles, so a total of 29 articles were selected for the review. Here 5 articles provided background information, and 24 articles described the psychotherapeutic treatment, 14 were case reports, there were 2 expert opinion, and 1 outcome comparison. And only English articles were considered. So the results showed that the retrieved articles emphasized very many of the same issues. So looking first at the complicating factors mentioned across different treatment traditions. Firstly, there was the challenges regarded identifying narcissistic pathology. And here it's especially this with being aware of the different clinical phenotypes, so that you actually recognize the narcissistic pathology even if the patient does not seem to be boastful, self-absorbed, but present with these vulnerable features with a lot of insecurity and social withdrawal and so on. And also the narcissistic pathology can be masked by the depressive symptoms, so that the basic personality structure or self-state is not really seen, as the depression is in the foreground of this. The next one, the next complicating factor, was this specific narcissistic resistance to treatment. And the third one were the co-occurring psychological factors of perfectionism, shame, and aggression. So going a little bit into the narcissistic resistance to treatment, you will see in the therapeutic setting and in the course of treatment that the patients often actively fight off painful affects. So it can be difficult to talk about difficult feelings, difficult affect states. They ignore them or bagatelize them or try to suppress them somehow. Also, they often suppress these feelings of vulnerability because it's very dangerous to actually embrace this vulnerability. Remember that if the grandiose self-image is threatened or destroyed, then the person will feel that they fall apart and become unassembled on the inner level. There's also a struggle against involvement with the therapist, and this is also, of course, the narcissistic pathology includes this sense of omnipotence. So for the patient to actually believe that another person could help them with their difficulties, or to take advice or work through something with the therapist, requires that the patient actually goes against the inner feeling of omnipotence. So you are working directly against the narcissistic structure here, and I will talk a little bit more about later what is important to do in order to engage the patient in therapy. The patient often have the need to control and dominate the therapeutic process, so they want to steer the course of the therapy. They want to be in charge of what topics are being discussed, what topics are maybe not being discussed, what is too painful. They also suppress feelings of dependency very actively in all relationships in life. So therefore also with the therapist, they are very afraid of becoming dependent or feeling feelings of dependency towards the therapist. They might seem very adaptive in the beginning, compliant, maybe coming on time, maybe often before time. But in the end, after a while, you often find that there is a great difficulty in engaging in the process that leads to change. So they want to stay on the surface. They don't really want to dive into the themes or the topics in the therapy that might be very challenging for the narcissistic structure that they have. So looking more at the psychological factors, so these often pose a challenge in the treatment and must be addressed. So perfectionism in itself enhances this self-esteem and self-presentation and helps the narcissistic patient to avoid feelings of inferiority. So therefore the therapist must aid at helping the patient replace this grandiose self-image with a more realistic and nuanced self-image that is not as perfectionistic. Furthermore, shame is a very difficult topic with narcissistic patients. Shame arises when the patient realizes the incompatible images of oneself, the ideal image versus the real image. And also narcissistic patients might have a very great difficulty in including and absorbing, working through feelings of shame. Feelings of shame are difficult for all of us. None of us like to come into contact with shameful feelings, or we do something embarrassing, but most of us are able to work through it and accept that we have done something wrong or something that provokes feelings of shame, and hence we can forgive ourselves, or we can move past it, or we can understand we've done something wrong and apologize for it, or we can accept that we're not perfect and sometimes we do embarrassing things. So the therapist must help the patient in gradually internalizing and accepting feelings of shame. So recognizing what they actually do when they come into contact with feelings of shame, because often they have a specific set of reactions that they activate to avoid feelings of shame. It could be devaluing other people, or denying that the thing has occurred at all. So by looking at shameful experiences, maybe from the childhood or from the life in itself, or maybe what occurs in therapy in the room, then you can help the patient to gradually accept shameful feelings. And lastly, aggression. Patients often express a great deal of hostility, and they demand perfect responsiveness from the therapist, and they might even feel vengeful against the therapist because they can see something in them that they don't like or that they don't agree with. So the therapist must understand this process and help the patient understand and recognize their own aggressive behavior, maybe by pointing it out when it happens in the room, or pointing it out when they talks about different incidents, situations with other people. And also the therapist must be able to endure the aggression that is projected onto the therapist from the patient and recognize it as these aggressive negative transferences and work with it accordingly. So when you look at the therapeutic considerations that are mentioned across the theories, the most importantly is the one of building an alliance with the patient. So this is point number 1. You have to have a very flexible and patient attitude, and you have to wait until the right moment before you start challenging the grandiose aspects of the personality pathology. So this means in the beginning, you have to listen to them, maybe brag about themselves or devaluate other people, and you have to be very careful to confront too much these notions, but to have a containing attitude and listen to it, and really work to develop this epistemic trust that you know that the patient can understand, that you see the patient in his own image and you understand what it feels to be inside him. So you have to listen to the patient's own narrative, spend a lot of time, let them tell their story without challenging it, try to understand where they come from and how they understand themselves. And then gradually, when the time is right, you can help them to identify the narcissistic pathology by pointing out discrepancies in the stories, pointing out countertransferences or transferences occurring in the room. But it's a paramount importance that the patient, they feel safe and secure before you start to challenge the narcissistic pathology. Otherwise, they will feel too shameful, too insulted, too provoked, and they will probably terminate the treatment prematurely. The second point is how to work with specific transferences and countertransferences. And with the narcissistic pathology, the idealized and negative transferences, they dominate and also alternate during the course of therapy. As a therapist, we often come into contact with specific countertransferences when treating these patients. And the ones that are described are feeling devalued and incompetent. The patient will very quickly install a feeling of incompetence in you, being very critical, and you have to recognize that your response to this is indeed a counter-transference reaction. You might feel very impatient or bored with the patient and this is often because when you engage in therapy with these patients, you're not really present in the room. They're not really interested in you at all, and you can feel that you just become this passive receiver that has to absorb everything that they tell you, and this can make you feel very impatient or bored. You might also feel exploited by the patient, and you might become very fearful of offending the patient, and also there might be a lot of idealization and admiration, and this is also a very important countertransference reaction to be conscious of, so that you don't fall into the trap of just being there and feeling like a great therapist, as long as you only talk about the things that the patient wants to talk about, but that you can also challenge the patient and risk losing this idealization. So to conclude what the review found, first and foremost, depressive symptoms are arising from the underlying narcissistic disturbances in these patients, and treatment of depression in this group of patients must be aimed at the underlying narcissistic pathology. There were many convergent points regarding specific challenges that are met during the therapeutic treatment. First one is to recognize the narcissistic pathology before commencing treatment. The next one is to deal adequately with the specific narcissistic resistance to treatment. The next one is to deal adequately with perfectionism, shame, and aggression, and as it arises and as a theme and a topic in this therapy, and to build an alliance with the patients. And the points of convergence regarding treatment modalities across different treatment traditions were to adequately deal with issues arising from the narcissistic pathology in order to prevent premature termination of treatment. Don't challenge the narcissistic defenses during the first phases of the therapy. The next one is to validate and support the patient's personal narrative. And then when the alliance is sound, you can start to address grandiosity, vulnerability, perfectionism, shame, and aggression. So only by cultivating a very empathic attitude, the therapist can help the patient to recognize the core of their challenges, and the therapist can aid the patient in accepting and integrating correcting life experiences that may lead to change. So help the patient to actually be aware of what happens in their life, and when they are challenged or criticized, or when they fail, they don't achieve their ambitions, that they can accept that and move on and feel good enough about themselves to get a nuanced self-image that is able to contain both negative and positive sides of your personality. So clinical pointers for effective therapy in this patient group is to have an adequate knowledge of different manifestations of narcissistic pathology, to adequately manage specific complicating factors during assessment and treatment, and to adequately address common psychological factors, perfectionism, shame, and aggression, and to adequately manage specific transferences and countertransferences that occur when you treat these patients. This brings us to the conclusion of this presentation and these 3 presentations. So I hope that you have gotten some good clinical pointers or ideas, and this can help you in treating these patients. If you need more information, then you can visit the journal's websites and retrieve the 2 articles that I've gone through here today. There is also an article that I've written about shame, perfectionism, and aggression in patients with narcissistic personality disorder that is in the latest special issue of Journal of Personality Disorder online on narcissistic personality pathology. So I hope you've enjoyed, and thank you very much for your attention.